Hi everyone, my name's Dr. Dana Canuso and I'm a podiatrist, and today I'm going to be talking to you about diabetes. And if you've heard those words from your doctor that you're a new diabetic, or maybe that you're borderline diabetic, this is a really important video for you to watch. And we're going to talk about how diabetes affects your feet and how we can keep from getting those complications that everyone hears about when it comes to diabetes and their feet. So what is diabetes? Diabetes is a higher level of sugar in your blood. So I want you to think about it like your gas tank. If you were to get any oil in your gas tank, your engine wouldn't run as effectively. And that's what happens with your bloodstream and diabetes. Your bloodstream has too much sugar in it, and it literally clogs up your blood vessels, and it keeps the blood from getting to where it needs to go. So in your feet, we have lots of little tiny blood vessels, and if the blood is thickened by your sugar, it's really hard for the blood to get to where it needs to go. And that's what leads to a lot of the problems with your feet. Other problems with diabetes, you could have problems with your eyesight. It can lead to kidney damage and failure. It can lead to nerve pain and problems. So diabetes is just not, everyone kind of blows it off and says, oh, I just have high sugar, but it actually can be a really devastating illness. And a lot of my patients refer to it as a silent killer because people underestimate how deadly it really is. And this video today is going to help you prevent problems with your feet and maybe even get rid of your diabetes completely, because that is a possibility. So, okay, you've just been told you have diabetes. Most people, unless you are insulin dependent and you've had it since you were a child, most people may actually reverse their diabetes. So I want you to have a little bit of hope that you have some control over your health. And when it comes to eating better, exercising, dieting, give it your all to try to lower your blood sugar naturally. And of course, follow the instructions from your doctor, but don't take this as a death sentence. You do have control over it. And that being said, nobody should ever have to have complications from diabetes with their feet if they are proactive and they talk with their doctor. So most problems with diabetes comes from letting things go and not paying attention to them. So when it comes to feet, most important, number one, you want to look at your feet every day. What do I mean look at your feet? Feel them. Look at your socks to see if there's any blood on them. If there's any cracks in your heels or skin. Now that actually can be a big problem, because if you have cracks in your heels, that's a great place for an infection to come in. And most people don't even realize, but the cracks in your heels, that dry skin, is actually the beginning of a fungus. It's not just dry skin. So for diabetics, this is exceptionally scary, because it is an entry for infection and problems to come into your foot. So I highly recommend using an over-the-counter foot serum to really get into those deep cracks and kill the fungus that's causing the problem. I actually developed a product to treat these cracks because patients in my office had the same problem. It's actually foot repair serum. You can purchase that online at www.drcanuso.com or even on Amazon or find spas and salons. So step one is feel your feet. Make sure that you have nothing problematic with your foot. And if you do, that's something to talk to your doctor about. Second, I'm sorry guys, but diabetics always need to wear shoes. It is for two reasons. One, we are protecting the foot because we don't want any nails or pieces of wood or splinters or anything to get into your foot, because a little problem can lead to a big infection, because that bloodstream that we were talking about, if you can't get the blood to cure the infection and problem quickly, then it can lead to an infection or, God forbid, an amputation. So we want to wear our shoes to prevent things from getting in, and we also want to wear shoes to give us support in the areas of our feet which are problematic. So a lot of you may have bunions or hammer toes, falling arches, or too high of an arch. Shoes will really help you prevent problems from occurring with diabetes that have to do with your foot type and mechanics. So wear shoes. Okay. Number three, do not get your feet into a hot bowl of water. So a lot of you like to soak your feet, use Epsom salt. that's okay. I'm not a big fan, but you definitely want to make sure that the temperature is not too hot and you're not in there for too long. Water can break down your skin's natural barrier, and that's a haven for infection to come in and attack your foot. So we don't want to soak in any water. And really, the big thing when it comes to diabetes and your feet is that you have to have a great relationship with your primary doctor or your podiatrist. You will not have any problems if you are proactive. If you notice a small blister, if you notice a small crack in the skin, if you notice any problems that you think, hey, this is something new, most people will let it go for a couple days. But if you're a diabetic, you can't wait a couple days. You need to go and speak with your podiatrist or general practitioner and discuss the problem with them. If you're proactive, they can write for an antibiotic. We can do whatever's necessary to prevent the problem from going further and, God forbid, leading to an amputation. So really, when it comes to diabetes and your feet, as long as you are a friend of your feet and proactive and checking out your feet constantly, you should not have any problems. It's those that are scared to go to their doctor or let a blister go for too long or have a cut or open wound and they decide to treat it themselves before getting the help of their podiatrist, that turns into a problem. So these are just a few tips and tricks that can actually really save your feet and unfortunately sometimes your life if you're a diabetic. And I hope that you will subscribe to my link below, and I will be posting lots more informational videos for you to learn about foot care and diabetes. So have a great day, and thanks for watching. Bye-bye.